can't believe we've been talking all night. Do you think I'm awkward?
Be here during this World Cancer Day. I'll talk very briefly about Max Foundation and what we do. Next, please. Okay, Max Foundation is an organization that was established about 25 years ago, and it's named in the memory of Max Rivarora, who was a stepson of our founder and the current CEO. Next, please. We are on a mission to accelerate health equity, and we work in countries where no one else is working at, and we support patients who no one else is supporting. Our vision is at it is. Next, please. Today I'm going to talk about our program, which is called the Max Access Solution. In short, it's Max. Next. And Max work with physicians. We work with the Ministry of Health, NGOs, and partner pharma companies. The pharma companies donate essential medicines to us, and the physician register patients into the program. And the medicines are distributed through local health systems, and then the program officers on the ground ensures that there is individualized care and follow-up of the patients. For our global impact, currently we have been taking care of over 35,000 patients, and our program are active in more than 70 countries. And we focus, our biggest program is CML, which is chronic myeloid leukemia. And recently with our baby program, breast cancer, which is HER positive, HER2 negative advanced breast cancer. And we work to strengthen the healthcare systems through training and support on where we run our programs, and we promote, eventually promote equity in cancer care access. So Mass in Kenya, we offer the biggest program. We offer free imatinib, which is Gleevec, for eligible patients. And also, as I mentioned, we have the Advanced Breast Cancer Program, and we are supported by the Ministry of Health through the NCD department. And also, we work closely with the Treasury, who give us exemptions so that we are able to bring the medicine in. And the medicine is distributed via KEMSA, and we work in about 6 hospitals in Kenya, including Nairobi Hospital, MTRH, Nakuru, Jaramogi Coast General, and of course KU. This is very hard to see, but this is the number of drugs that we are currently supplying. Our major, which is Gleevec, treats 7 conditions. Then we have Sutent, which is a second line for GIST, an advanced RCC, and also well-differentiated PNET. We also have Bosorif, which is a second line for CML. We have Inviata, which is for metastatic and small lung cancer. And then we have Iclusig, which is a third line for CML. And of course, the Vacinios for breast cancer. And we have one outside, which is not cancer, called Vidamax for wild-type hereditary ATTR-CM. Next, please. So what have been the benefit of our program? We have seen reduction in mortality, especially for the CML population, because they are able to get diagnosed quickly and then able to start treatment immediately. Then we have removed the financial barriers because the medicine is given for free. So, like for Gryvec, a month dose will come to around 250,000, but the patient usually get that medicine for free. And of course, we build capacity in healthcare systems. When we started the program, diagnosis used to take 3 weeks because the test had to be taken to South Africa and the patient had to wait for 3 weeks to start treatment. Nowadays, your blood can be taken in the morning and you have a medicine the next day. The challenges, of course, is we depend on donations from the pharmaceutical companies. So that dependency, recently we had one donor withdrew the program, so that now means we cannot support other patients except the one already on the program. Then the logistical and regulatory handles, before we are able to import the drugs, it's usually a very long process with a lot of paperwork. So that's also another challenge that we have. And the limited scope of cancer types that we cover, we get a lot of requests that we cannot be able to support. So with that, thank you very much. I don't think we'll, unless you want to talk about it.
To be here today, and we extremely appreciate the Kenyatta University Teaching and Referral Hospital for continuously being at the forefront in cancer research, training, and care. Can we please give them a round of applause for being trailblazers in the cancer care and research in this country? Kenya Network of Cancer Organizations is the leading umbrella body for civil society organizations in this country, and we are dedicated toward cancer care and controlling different aspects. And I'd like to ask, do we have any lived experience in the room? Just a show of hands. Patients, thank you very much. Can you be upstanding? And thank you. Can you be upstanding? Led from the front by Dr. Batul. Can you please appreciate Dr. Nashat of NCI Kenya, my very good friend. Thank you for leading early diagnosis, and God knows why you went through that process. And can you please appreciate our sister also at the back? Can you please that hair can only come after chemo. So thank you very much for braving the fight. And today we are saying you are the reasons why we are here. You're the reasons why we are saying united by unique. And every other caregiver in the house, you're a caregiver to a cancer patient at home. You have a friend, a relative. Let's see by a show of hands in the house. Thank you so much for staying up late and for understanding them. Healthcare workers, we are appreciating united by unique. Kenya Network of Cancer Organizations, this theme is very important to us because we experience firsthand on what to read on paper, what to see in data. We know how catastrophic cancer care and management can be. We know how families have to choose between having cancer treatment or having a balanced meal in the family. And as KENCO and as a representative of the civil societies of this country, we are saying that cancer does not have to impoverish families. Cancer does not have to turn families upside down. So while we appreciate these gains and we are appreciating the work that we have had over time with KU referral, we have trained healthcare workers here on effective communication for cancer new diagnosis. We have distributed over 5,000 booklets on cancer education materials for patients and caregivers. If you're not clapping for KENCO, you're jealous. Yeah, over 5,000 booklets distributed to this facility, and we are still hoping for long-term partnership with KU referral so that there is effective communication, especially of new cancer diagnoses. However, to the Ministry of Health, we are appreciating that you have revised on policy on paper what we recommended for you for Social Health Authority. On paper, the President announced to us towards the end of last year that they have effectively revised the cancer care package from Kenya shillings 550,000 to 800,000 Kenya shillings. And today, being World Cancer Day, and the civil society organizations, we have already released a press statement to this government. We want to see that 800,000 Kenya shillings actualized in hospitals. And secondly, we want adequate reimbursements to hospitals, to referral facilities like these ones, other referral facilities across the country, so that the Social Health Authority adequately reimburses care. Because failure to do that, we face paralysis of oncology care in this country, and when paralysis of oncology care in this country is faced, then we are facing what what we call survivorship challenge. So those are our two main messages, that we need that actualization of the 800,000 Kenya shillings. I know this hospital has demonstrated very well that SHA is working. We want it to actually work, but we want the 800,000 Kenya shillings that the head of state promised us to actually come on paper, and we want the referral hospitals to be effectively reimbursed. So for those very few remarks, World Cancer Day. So we celebrate survivorship, we celebrate you, and we are here to say that no one should face cancer alone.
From KUTRRH, that's Kenya Medical Research Institute. We are very happy and grateful to be partners in this, and we have collaborated together for the last 2 years, and we look forward to having more collaborations, and not just in the areas that we have collaborated, but to widen our collaboration together. So I'm so impressed by the kind of work that you guys are doing here at KUTRRH. It's actually a real flagship program, as you say, the cancer care, and that really makes a lot of difference, because for a very long time we've had people go out of the country to get some of the services that they are now accessing here in Kenya and in this facility. So thank you very much. Kudos for the good work that you do. In KUTRRH, we mainly work on research, and we have several program areas. Cancer falls under the NCD, that's the non-communicable diseases research. And I bring you greetings and regards from the head of the cancer registry, and that is, she's also the head of the cancer thematic area research. She's called Anne Coril. She was supposed to be here this day with us, but apparently she has been sent to represent the institute elsewhere. So receive our greetings. I also would like to briefly, because of time, just go straight to read the speech from our Director General, KUTRRH Director General, Professor Elijah Songok, and we are grateful that he gave us full support. KUTRRH is a great supporter of what you people are doing. And just before I read, I'd like to request the KUTRRH staff who are here to just kindly stand. Kindly, we participated yesterday in the screening programs, wherever you are. Yeah, that is KUTRRH. Thank you. You may have your seats. So this is the speech from our Director General. Ladies and gentlemen, distinguished guests, colleagues, partners, and friends. Today, as we mark the World Cancer Day, we stand united by a shared purpose to reduce the burden of cancer and to ensure that no one faces this disease alone. This day is not only about statistics or science, it's about people, mothers, fathers, children, and communities across Kenya whose lives have been touched by cancer and whose courage continues to inspire our work. As a research institute, we believe that knowledge saves life. Research is the foundation upon which prevention, early detection, accurate diagnosis, and effective treatment are built. In Kenya, cancer is no longer a distant health challenge. It is in our homes and hospitals, affecting families across all regions and backgrounds. This reality calls for locally driven research, strong health systems, and policies grounded in evidence. Today's global theme, United by Unique, reminds us that cancer care must be people-centered. Equity, compassion, and access must guide our actions. Every Kenyan deserves timely screening, reliable diagnosis, quality treatment, and supportive care, regardless of where they live or their ability to pay. Achieving this requires collaboration between researchers, healthcare workers, policymakers, civil society, and our communities. We are encouraged by the progress being made in Kenya, but we know there is more to be done. Let's today renew our commitment to invest in research, strengthen partnerships, raise awareness, and support those living with cancer and survivors who walk this journey every day. On this World Cancer Day, let us move from awareness to action, from intention to impact. Together, we can build a future where cancer is detected early, treated effectively, and faced with hope, not fear. Thank you. Professor Elijah Songok, Director General, Kenya Medical Research Institute. So thank you so much. God bless you.
KU referral falls under Roysambu sub-county, so that is why I am here. But I'm also representing the Chief Officer, Medical Services, and the CEC, and the Director for Medical Services. I recognize the presence of our chief guests, the healthcare workers here, colleagues, and partners. The theme for today is what? United by unique. So this, as explained by Dr. Abeid, each and every cancer patient has a different journey, which is unique. Okay? I know as healthcare providers we have an understanding for that. That is why it is important for us to know. Cancer remains as a huge burden in our country. It is not just a disease. It's not just a medical condition. It has become a social, economic, mental, financial issue. So thereby leading for us as managers, as healthcare providers, it needs a collaborative effort. I dare say that it is a war. You know, in a war, you have to be prepared. So for you to be prepared, you have to have the means. And the means need what? Planning. So it's a challenge to us as managers, as high-level decision makers, for us to strengthen the systems. Because without strengthening those systems, you will not go anywhere. Especially when we look at the building blocks. The most important here is the human resource and the financing. If you don't give much financing that is needed, then the war will be lost in the beginning. If you don't have the capacity, if you don't have the people who could be there in the front line curing these menaces, then there's nowhere that we're going to go. I would just like to highlight, before I highlight, I want you guys to know that the burden of the disease in the country, when you go to the county level, so obviously it's going to be Nairobi County because of the population and the high levels of referral. So it's important for us to know what we are doing in Nairobi County. Okay, so in the absence of the Chief Officer and the Director of Medical Services, I have highlighted some of the things as what they have given me in the last year. In 2025, Nairobi City County significantly strengthened its cancer care support, primarily through a collaboration with the City Cancer Challenge, the CCAN, to launch 11 locally led projects. These initiatives are designed to improve diagnostics, treatment, equity in care, addressing the high burden of cancer in the country. So what are some of the points? The 11 transformative projects that is launched in June 2025, and improved treatment access. The Ministry of Health and the Nairobi City County are working to reduce the cost of HER2 plus therapies to around 40,000. Targeted screening, the focus has been on early detection, particularly for cervical cancer, through programs like CF Kenya Connect, which supports facilities in Nairobi with, for instance, thermal ablation. There has been donations In 2025, $1.5 million was made to the Needy Cancer Health Initiative, the NCHI, in Nairobi to assist with medications and treatment costs for over 2,000 populations. So future policies and actions is that Nairobi is one of the 3 global cities partnering with CCAM to lead on gender equitable cancer care 2024-2030, ensuring that particularly for women, care is tailored to specific needs. So moving forward, as we mark the World Cancer Day, let us recommit to ourselves that strengthening cancer prevention and early detection in Nairobi County and beyond, expanding equitable access to quality and affordable cancer care, supporting patients with dignity, compassion, and hope, advocating for continued investment in cancer services and research. So to us, back to us as healthcare practitioners, managers, and high-level decision makers. And the President consented to enact the Primary Care Act. As a leader of a sub-county, HMT, this concerns me a lot. Why? Because it was a framework for us to access primary healthcare services. You know, when you talk of primary healthcare, there's an aspect of preventive promotive. And you know, it is a challenge to us all. The 47 counties actually should have a cancer diagnostics and treatment center. Each of the 47 counties. Why? Because when we realize that the goal is preventive more than the curative medicine, especially when it comes to cancer, we talk of screening. Early detection means less costs in screening. So when all the 47 counties have a screening center, diagnostic center, and treatment center, then the burden of treatment at the national level, especially in facilities like KUTRRH, it becomes very low. Why? Because we have prevented actually these diseases coming, or we have actually early detected it. So it's a challenge to us as leaders to still strengthen the health systems, okay, to still bring in more personnel, to bring in more financing for these things to happen. And for us, Nairobi County, we are very proud of KUTRRH because it's a trailblazer, it's a trendsetter, and I have not been, mimi si mgeni hapa, I think most of you know me. We have already collaborated in various other programs, and here we will. Even in these cancer departments, we are going to do that. We have our CHUs, we have our community strategists, and all other HMT team in the sub-county. So we're going to give you the support that is needed, as well as the Nairobi County CHMT. I don't want to talk a lot. I would just like to
see patients at the county level, Taita Taveta County, and I also serve at the National Cancer Institute as the head of cancer prevention and control. It's an honor to be here on behalf of our CEO, Dr. Elias Melly. He would have really loved to be here, but due to competing tasks and other meetings, he was not able to be part of this meeting, but warm regards from him. I just have a question. All of us have been seeing this theme about united by unique. Can someone just translate it in Kiswahili, which is our national language? You'll get a gift, maybe. Be daring to try. Try. It's our national language, so any translation, any volunteers who are willing. Let me just make it easy, because I'm from the coast and Kiswahili is like wakipekee. Yes, you're almost there, very good. So kuunganishwa na upekee, our uniqueness. So kuunganishwa na upekee. Upekee, you know, kipekee can stand for one person, but now we are all together, so upekee. Are we together? All right, so I'll just try and be quick. I really like talking, And I'm very passionate because myself a warrior, at least for now. So I am very passionate when it comes to matters related to cancer, being an oncologist and being the head of cancer prevention and control. Good afternoon, distinguished guests, partners, colleagues, survivors, caregivers, and friends, all protocols observed. And we all know that when people hear the words cancer or World Cancer Day, they often expect three things: serious faces, sadness, heavy statistics, and very long speeches, and even tears. But tears and all this, we are going to save it for the funding meetings, not today. Tears and the very, very long speeches are for the funding meetings. So, I promise you, today, at least 2 out of 3 will have this same concept. Because while cancer is serious, our gathering today is also about people. And people, despite everything, still laugh, still hope, and still show up. Seriousness doesn't always mean sadness. Today's theme, United by Unique, kuunganishwa na upekee, could not be more fitting. Cancer reminds us sometimes very rudely that every human being is unique. Different bodies, different journeys, different responses to treatment, and yes, very different opinions during meetings. And yet here we are, united, tumeunganishwa na upekee wetu. In Kenya, unity has never meant sameness. If it did, we would all have one language, one staple food, and one opinion on how we should make chai. How we should prepare chai, and we know we'll never agree on chai, how to prepare chai. Even mandazi and mahamri in Coast is made differently. Ngumu and vishete in Coast is also different. Excuse me, because I come from a foodie community, food has to feature in this conversation as well. So, but unity, as we know, it means standing together despite our differences, and that is exactly how we must confront cancer. Cancer does not ask for your tribe, your job title. Myself being an example, being an oncologist, it did spare me. It wasn't even scared of me knowing this disease from a cellular level. It still attacked me. And your postcode, or whether you finally started exercising in January, it does not wait for payday, public holidays, or after exams. And most inconveniently, it doesn't send a WhatsApp message before it arrives. That is why awareness, early detection, and access to care must reach people before the cancer does. As the head of cancer prevention and control at the National Cancer Institute of Kenya, I am often expected, or we as the institute are often expected to have all the answers. Let me be very honest with you. Mostly we have very good questions, we have a committed team, and that helps turn those questions into answers, into action, in partnership with our mother ministry, the Ministry of Health. And one question always guides us constantly: how do we make cancer care in Kenya more human, more equitable, and more effective? The answer, I believe, lies in embracing our uniquenesses, because cancer journey of a young mother in Kilifi and an elderly man in Nyeri is totally different. For a child, treatment for a child, and for an adult who still has to go to work while receiving treatment, the journey is also different. The experience of a child with cancer and survivorship does not look the same for everyone. For example, in my case, I always have to read the current statistics, the current finding, the survival for post-brain tumor specific, the one I had. I always look at the recent updates. So it's an anxiety situation, and at the same time, it's also giving me reason to be relentless and fight this disease. And also be a symbol of hope for all the others who are facing this diagnosis. And survivorship, yet despite all this uniqueness, one thing remains common: no one should walk this journey alone. The National Cancer Institute, we have learned that fighting cancer is not just about hospitals, machines, and medicines. Important as they are, it's about systems that work, communities that understand, and partnerships that endure. It's about research that reflects our people, policies that protects patients, and service voices that reach beyond major cities to every county. And yes, it is also about patience, because cancer work teaches you patience whether you like it or not. The good news, and there is good news, is that progress is happening, cancer research is advancing, early detection efforts are expanding, survivorship is no longer an afterthought. It is now part of the conversation, and we are moving from asking, can we treat cancer, to how do we help people live fully, meaningfully, and with dignity before, during, and after the cancer diagnosis and even treatment. And that is progress worth celebrating, even with a smile. Makofi. But let me be clear, progress does not happen by institutions alone. It happens when governments, healthcare workers, researchers, civil society, the private sector, survivors, caregivers, and communities move together. Trust me, the government, our government, is really giving cancer the front space. It's investing, it's working round the clock, asking, taking people for trainings even out of Kenya, for us to understand and come up with homegrown solutions, solutions that are customized to our circumstances. So we are united, but not identical. We are united by our unique roles. Some of you here save lives directly, some advocate, like my very good friend here, Phoebe, some fund, some teach, some listen, some survive, and every role matters. Today, as we mark the World Cancer Day 2026, let us remember this. Cancer may make people feel isolated, but our response must always be collective. We are no longer going to work in silos. The care must not be fragmented anymore. Even decisions, we have to bring everyone on the table. We just don't invite the specialists just to cut the cake. Even before, during the preparation of the cake, the decision, specialists and all other parties have to be given a seat to make these decisions and improve the outcomes. Cancer may affect us differently, but our commitment must always be shared. Let us continue to build a Kenya where your chance of surviving cancer does not depend on where you live, how much you earn, or how early you were lucky enough to be diagnosed. A Kenya where science meets compassion, where policy meets people, and where uniqueness is not a barrier but a strength. And finally, let us remind ourselves and each other that it is possible to fight cancer seriously, passionately, and relentlessly without losing our humanity, our humor, and our hope. Because when we are truly united by our uniqueness, we become stronger and than the way cancer ever expects us to be. Thank you, and let us continue to work together. God bless you. God bless Kenya and every part of this world. Thank you.
We are many and they have supported us. Our colleagues in health, ladies and gentlemen, good afternoon. I think most of the guests have been and partners have been recognized, so I will not go into that. So I'll go straight to my speech, and before that I would like to appreciate Dr. Abeid and your team. Actually, this is one of the team that as partnership office, I speak as partnership for now. We enjoy working with them. We enjoy planning their events because they take up the responsibility. So Dr. Abeid and your team, please let's give them a big hand. Thank you so much for leading this initiative and for the work that you have done. And for our team who have done the skit, I think the audience should be expanded. I think we need to plan a visit either to what we do with our community. That is missing. So I think the next event, and maybe during this month before the month's end, let's see who we can go to a church or one of the communities around here and share our skills. But it was glad, and I'm happy to have seen everybody's different skills. So today we gather to mark the World Cancer Day under the theme, United by Unique. So a lot has been said by what this United by Unique means. So this theme reminds that while cancer affects people from all walks of life, each cancer journey is personal. And it is personal even for the doctor, for the nurses who deal with those patients, for the patients for themselves, for the caregivers, for all the team that put effort, the bioengineers who are every day trying to come up with different machines or technologies, the pharmacists, the researchers who are every day trying to come up with different solutions. Every journey is personal and every journey is unique. Every patient has a unique need, yet we are united by a shared responsibility to prevent cancer, promote early detection, and provide quality and compassionate care. At KUTRRH, this principle guides our work every single day. Every moment we wake up, we report to the office. Is it the doctor, is it the nurse, the administrators, the finance officers, everybody. We are committed to patient-centered and comprehensive cancer care, supported by modern technology, as you've heard, and more so supported by the strong partnerships that you have seen here today and you have heard them speak. KUTRRH hosts a comprehensive breast cancer center and is equipped with advanced diagnostic services, including the SPECT-CT, the PET-CT, which enable accurate diagnosis and staging. In addition, our CyberKnife technology allows for highly precise, non-invasive radiotherapy, improving outcomes and quality of life for our patients. KUTRRH, we are committed to improving our technology in diagnosis and treatment every day, and we are working with partners to make this possible. As part of World Cancer Day activities, as you have heard, yesterday, KUTRRH took a different direction. Normally we have our screening camps here at the hospital, but this time with Abaid and his team's leadership, we decided to go to the community. So KUTRRH conducted a cancer screening outreach program at community prisons where we reached 145 individuals. And this was possible because of our partners. You've heard KUTRRH was there in big numbers, NCCP, NCI, all of you who have made this possible, Max Foundation and everybody who supported us yesterday. The screening focused on prostate, breast, and cervical cancers and included essential diagnostic services such as HPV testing, pap smear, and ultrasounds. And I'm happy to hear, our partners saying that they were able to be screened yesterday for the first time, and they're going to spread their awareness. They're going to be our ambassadors. On those screened, 61 were male, representing 42% of those who were screened, and 84 were female, and this is 58%. From the 145 people we screened yesterday, 7 individuals required follow-up and were appropriately counseled and linked to care. So thank you for the team that was there to provide the counseling. This outreach highlights our commitment to ensuring that cancer screening services reach all populations, including those in institutional settings, and more so the community that is around us. We sincerely appreciate Community Prisons, the Community Prisons Health Center, and the Prison Administration for hosting the screening camp. We also thank the Nairobi City County government, particularly the Roysambu Sub-County Health Team, for their support and collaboration. We are deeply grateful, and I will say this again, because KUTRRH and I'm as the Director of Partnership, I know what our partners bring to the table. I know what you make possible for us. Indeed, we cannot walk this journey alone. So I'd like to appreciate our partners who made this initiative possible, and some of them have worked with us for years, since the inception of the hospital, and they continue to support us. Tima Sako, Asanteni Sana, Zamara, you have been with us through this journey. Faraja, we don't even know what to say to Faraja. The support you give our patients, the support you give the hospital is immense. The Max Foundation, CISCAN, Nairobi County, KUTRRH, the National Cancer Control Program, APSA, always coming through for us, Aquamist, KENCO, your support demonstrates the power of collaboration in the fight against cancer. And indeed, we are united by unique. So World Cancer Day is a call for action. Together, we must continue to strengthen prevention, expand screening, and ensure access to timely diagnosis and treatment. Today, we also take time to celebrate our cancer survivors, the men, the children, the women whose courage, resilience, and determination continue to inspire us every day. Our survivors remind us that cancer is not just statistics or systems, but about lives, about families, and more so about hope. So at KUTRRH, survivorship care is an integral part of our cancer program, as you've heard, ensuring continued follow-up, psychosocial support, and quality of life beyond treatment. Equally important as a hospital is our role as a research and teaching hospital. Through clinical research, through training, through collaborations with national and international partners, we generate evidence that informs best practice, guide policy, and strengthens cancer care in Kenya. Research enables us to deliver care that is not only compassionate, but also evidence-based, innovative, and responsive to the unique needs of our patients. So our esteemed guests, our colleagues, as KUTRRH, we reaffirm our commitment to working with all stakeholders, private sector, Ministry of Health, everybody we work with, to reduce the cancer burden in Kenya. While every cancer journey is unique, our response must always remain united. Thank you all for your commitment. Thank you all for your partnership. And we continue to say as KUTRRH, we are committed to remain united to fight cancer. So together, we are united by, and with those brief remarks, I would like now to invite Dr. Bor,
partners, civil society led by KENCO, colleagues from the Ministry of Health and staff from KU, cancer survivors. I hope I've included everyone. Or should I say ladies and gentlemen? Thank you. My task here is very simple. I'm only here to do three things. And the most important is the last one. So the first one, I want to thank KU and congratulate you on hosting this World Cancer Day commemoration. And not just this one, but even the previous, no important cancer day, passes without KU recognizing it and using it as an opportunity to create awareness and bring people together, celebrate survivors. So congratulations for that commitment. I know it's not easy because at national level we also plan these events. And I've been here a number of times. Thank you. Thank you for what you do. Thank you for the partners who support KUTRRH and who support us at the ministry in this fight against cancer. That was number one. Number two, I want to just recognize colleagues from the Ministry of Health, specifically from the National Cancer Control Program. Maybe you can stand and wave. I know they have been with you from morning and in the walk, and I can see a few of them are missing, but I also see many chairs have been, vacated at this point. I know we are tired, and I was telling Dr. Gadesha, maybe next time the chief guest should start, and then, but you know that is not protocol. Thank you, my colleagues, my team from the National Cancer Control Program for what you do and your commitment to this cause, and for leading from the front. So my third and most important task is to invite Dr. Gadesha so that she can give her remarks on behalf of the Director General for Health. I'll tell you something as she comes. Dr. Gadesha is a very gentle person, very soft-spoken, but she is a powerhouse. And for that reason, I want you to stand and welcome her. Given that we are the division of NCDs, cancer and NCDs, we have been sitting too long, isn't it? So maybe we stretch a little before, stretch freestyle before Dr. Gadesha comes to the mic. And
KUTRRH, I noted that you're not just only healthcare workers. In the skit, there was also someone from the catering unit. So I also want to acknowledge our county colleagues, Dr. Guyo, our partners and sponsors, and our survivors, the most important people why we are here. I also bear greetings from Director General. He would have loved to be here, but due to another equally important occasion, he was not able. And he also commends KUTRRH for the work you're doing in the cancer space. I also echo those sentiments because I was here last year taking a group of people from outside Kenya. We have had a group from Uganda, Malawi, Ghana, and other countries, and they were really impressed by the type of facility you are running here, starting from simple things like they were saying, it doesn't smell like a public hospital, and also now the big things like the advanced technologies that you have. So congratulations for that and keep it up. I don't know whether you get tired of being told this, because I'm sure so many people keep on telling you as a hospital that you're doing good. You've set yourself up above the rest. There's a meeting I recently attended, and someone said that hope is not a strategy. And I was seated there listening to today's proceedings, and I was thinking, what is this I'm feeling? Because after hearing what has been spoken today from the imaging team, the surgical team, the snippets from Dr. Abeid about the support groups, the reaffirmation from our partners and sponsors, and the stories from the survivors, both of them. If not, I know maybe it's a feeling, but I think for me it's just a renewal of we need to do that extra, because first of all, we are making a change in someone's life, and because we are doing it together. So that hope sort of is a strategy, and for me it's been proven today by what I've heard this morning. So that I don't take much of your time, let me go straight to the message from the DG. Kenya records an estimated 45,000 new cases and over 29,000 cancer-related deaths each year. And the most common cancers include breast cancer, cervical, prostate, colorectal, and esophageal cancers. Many of these cancers are preventable, screenable, or highly treatable when detected early. But sadly, late-stage presentation remains common and continues to drive high mortality, high cost of care, and poor outcomes. Prevention and early detection remains a cornerstone of the Ministry of Health cancer control approach, as emphasized by the vision of our National Cancer Control Strategy, which states that Kenya is striving to have a nation free from preventable burden of cancer. Indeed, early detection saves lives, reduces treatment costs, and improves quality of life. The ministry is scaling up HPV vaccination, risk reduction interventions, routine screening, and early referral, especially at the primary healthcare level. Kenya is strengthening the integration of cancer prevention and control services into primary healthcare to ensure early detection, community awareness, and timely referrals. County health facilities are urged to provide screening services for all eligible populations with prompt referral for cancers that cannot be managed at county level or those that are complex or advanced to regional cancer centers or to national referral hospitals. And I'm glad, Dr. Guyo, you also are of those sentiments and started with the leadership call, and I'm glad that Nairobi City Council is taking up that leadership mantle. The government continues to decentralize cancer services to improve access across the country. Significant investments are being made to expand and strengthen regional cancer treatment centers, where we have regional centers at Mombasa, Nakuru, and Garissa that serve defined catchment areas and complement national referral facilities, including our very own KUTRRH. This approach reduces patient travel, decongests national hospitals, and improves continuity of care. Offering quality care remains a key mandate of the Ministry of Health, and in this regard, we continue to lead the development and regular review of national prevention and control policy framework. The recently updated National Cancer Screening and the cancer treatment guidelines and the radiotherapy protocols promote standardized, evidence-based cancer management and ensure that the healthcare workers are equipped with the necessary competencies at all levels of care. When it comes to digital and data systems, we know that strong data systems are crucial for effective cancer control. The ongoing investments in digital health superhighway will enable real-time data transmission and system interoperability. Thus, it will improve cancer data that supports planning, resource allocation, monitoring of outcomes, and research. Moving on to financing cancer care and financial risk protection, the government is strengthening financial risk protection for cancer patients. Yes, Phoebe, we've heard your call, your continuous call that yes, we should stop and move to the actualization. We did improve the cover from 550,000, as you said, to 8,000 Kenyan shilling. Let us acknowledge at least that move, but we are not sleeping. We are trying to ensure that it will actually be what is in our health facilities. Addressing cancer requires a whole of government and whole of society approach. The ministry continues to work with private sector, faith-based organizations, civil society and development partners. County governments are encouraged to continue growing cancer budgets.
Siku ya saratani duniani hii leo imeadhimishwa hospitali ya chuo kikuu cha Kenyatta ya mafunzo rufaa na utafiti, ambapo madaktari walielezea wasiwasi wao kuhusu ongezeko la visa vya saratani, wakihimiza uchunguzi wa mapema, upanuzi wa uchunguzi na upatikanaji wa matibabu nafuu. Kama mgeni rasmi, Daktari Gladwell Gashetha kutoka Wizara ya Afya alisisitiza juhudi za serikali za kuimarisha huduma za saratani kupitia ushirikiano, ongezeko la ufadhili wa kifedha, akisema hatua hizi zina lengo la kuboresha upatikanaji wa matibabu na kupunguza mzigo wa kifedha kwa wagonjwa wa saratani nchini.
The ministry, we've been able to decentralize the care for cancer to regional centers, as opposed to the past where treatment was only available in Nairobi and MTRH through in Eldoret. We now have regional cancer centers that are based in Garissa, Nakuru and Mombasa. So this means that patients don't have to travel from far to get the much needed treatment. We are also ensuring that at the grassroots level, we are ensuring our Kenyans are able to know have the right message of prevention of cancers, and we have also entrenched or empowered our community health promoters to ensure that they know what messages to tell the people out there.
Caroline Nguki, mkurugenzi wa utafiti na ushirikiano, alielezea teknolojia mpya za kisasa katika hospitali, akisema sasa wanatoa uchunguzi wa saratani, lengo likiwa ni kuongeza uchunguzi mapema na kuboresha matokeo kwa wagonjwa.
We are very advanced as a hospital in terms of screening, in terms of diagnosis and providing care for cancer, different cancer. Cancer treatment is our main flagship. So we shall continue to provide this to our community and to everybody who's out there. Even in terms of training, we are advocating for creating awareness. We had a walk today around our area to create awareness and to invite people to come for free cancer screening.
Abeid Athman, kiongozi wa opnolojia, alionya kwamba uchunguzi wa visa vya saratani katika hatua za mwisho unaongeza vifo. Alibainisha kwamba saratani sasa ni moja ya magonjwa yanayosababisha vifo vingi nchini Kenya, akihimiza kampeni za uhamasishaji na upanuzi wa uchunguzi mapema.
Tumekusanyika hapa ili tuweze kuwajuza watu ni dalili gani za saratani, kuhamasisha watu waende kwa uchunguzi wa mapema, kwa sababu saratani ikipatikana mapema inatibika. Mgonjwa ambaye amekuwa saratani, ambaye ana saratani, wote wanaishi kwa muda mrefu. La kusikitisha ni kuwa Kenya asilimia kubwa watu wanagunduliwa wakati saratani imeshaenea, iko stage kubwa ambayo matibabu inakuwa gharama ni kubwa na pia inakuwa ni vigumu mtu kuweza kupona. Ndio sababu tunaona takwimu zinaonyesha kansa imekuwa namba 2 katika sababu ya kifo nchini Kenya.